The Adult Service Division is the largest division we have at Bristol Community Health. We are a multi-professional service. We have nurses, physiotherapists, podiatrists, dietitians, a range of professions working within the teams. We have approximately 40 different clinical services that run out of a variety of settings, both from people's homes but also within clinics across the city. We offer a range of opportunities in the community, working both within multidisciplinary teams or uni-professional teams. We offer holistic care to patients, ensuring that we deliver the best care for the people we serve in Bristol. We've recently launched our Making Lives Better strategy, and a central strand to that is about putting people first. Through the putting people first element of the strategy, we are ensuring that we invest in staff across the organisation to make sure that they are able to deliver the best care for people in Bristol.
The community nursing service is made up of 6 large community teams. We all cover different areas of Bristol, and we work within those large teams to see patients in their own home. They're people who aren't able to get out and about to access treatment elsewhere in clinics. What makes this job really interesting is because we get to see quite a wide variety of patients in their own homes. By that I mean we see a lot of people with complex nursing needs. So you're not just treating one patient with one problem, you're often treating many different problems, and that can make it quite a challenging role, but also keeps the job really interesting. I think BCH is a brilliant organisation, and it's certainly the best place that I've ever worked. One of the main reasons I think this way is because of the career opportunities. There's just so many areas that you can choose to develop into, and I think that's brilliant.
As a district nurse team leader, I visit patients in their own home. I also manage complex patients on a caseload. I also manage a team of community nurses and their development. I joined 11 years ago as a Band 5 community nurse. Bristol Community Health supported and funded my specialist practice qualification in district nursing. I've previously worked in the hospital. Working in the community setting's very different. You get to work with people on a one-to-one basis, and you can involve them in the planning and assessment stages of their care. Shared decision making is really important in the community.
On a typical day, I would come into the office in the morning, be greeted by all my team members. We go out onto visits to see patients, which can be completely varied, anything from wound management to administration of medications. The role is very varied and every day is different. The most rewarding thing about my role is the impact we have on patients' lives. A lot of the feedback that we've received from patients and their families, they do refer to us as angels, which makes it all worthwhile.
The physiotherapy service is a service that's preventative. What we aim to do is help people return back to doing things that they were able to do pre-hospital admission. If they've been housebound for a period of time, we try and get them back to accessing the community.
Compared to a hospital, we spend a lot more time with the patients, which allow us to develop close relationships. From that, we can make a more tailored treatment program and work together with them to address these specific goals that are relevant to them.
You're encouraged to spend time with other professionals. So for example, I spent time with a full specialist nurse to try and pick up on some of her skills so that then it would improve my overall assessment and improve the service that I was giving to people.
I think the main thing that will make you successful here is just being open to opportunities. The diverse rotational scheme we have, it gives a real platform for us to progress our career.
You have to be willing to be nice and happy and encouraging and be helpful so that you can help out your other colleagues when in need.
Podiatry service within BCH is predominantly a high-risk service. We work with a lot of patients with diabetes, peripheral arterial disease. Increasing patients' mobility is really important for me. If that helps that patient stay out of hospital and keeps them sort of active is really important. And having that kind of daily impact, I think, is the most rewarding thing. Working in the community for me is really important in the sense of I live in Bristol. I really like helping the local population that I live near. It's a diverse group of people, and it's quite important to sort of put into your local community from that point of view.
I think it's quite a privilege to work in the community sector. We get to work with people in their own homes and work on activities and issues that are important to them. My role essentially is enable people to return to the tasks that are important to them, enable them to be as independent as possible. I've worked for Bristol Community Health for about 6 years. I've always enjoyed fantastic support from colleagues. I've worked for other organisations where the support hasn't always been there, but at Bristol Community Health I've always enjoyed working with superb colleagues where we work as a team.
The Diabetes and Nutrition Service is an integrated service. It's made up of a team of diabetes specialist nurses and a team of community specialist dietitians. We work very closely together. We do a lot of multidisciplinary joint working. We also deliver diabetes education across the whole of Bristol. In addition to that, we do teaching and education for those healthcare professionals who are supporting that particular population group.
Working in the community feels less task-orientated versus working in a hospital. I felt that there were more opportunities to progress without losing that patient contact.
I love working in the community. I love being able to meet people in their own environment. I love working autonomously and flexibly and being able to empower people to self-manage their long-term condition.
Since joining BCH, I've had a number of opportunities for formal education courses and the opportunity to shadow people in a specialist role to upskill myself. I've just moved from Band 6 to a Band 7 diabetes specialist nurse role, and I have plans to undertake my nurse prescribing course soon.
I think one of the key things about Bristol Community Health is essentially it's staff-owned. We all have a share in the company, and I think that helps us all to be responsible for making sure the organisation succeeds.
There's lots of opportunities to develop your ideas, knowledge and skills, not only as part of the immediate nursing team, but also the wider multidisciplinary team as well.
They offer lots of opportunities for career progression for nurses, and they do really look after you here.
I feel like they're quite innovative. They're very sort of flexible to new ways of working, which I find is quite refreshing as an employee.
Bristol Community Health is a really forward-thinking organisation. They value their staff and employees, and they're incredibly supportive as well.
They have a clear focus on staff well-being, and I've always felt that they have focused on the learning and development of their staff.
They do see where there's that potential, where there are skills, where there is scope for somebody to develop and improve, and if there's the opportunity to nurture that and offer the opportunity, they do.